Hi, I'm McKenna,
And I'm Jensen.
and we're here to talk to you today about Hannah. As many as you know, Hannah has not been in school for a while. She has been in the hospital with cystic fibrosis. So, cystic fibrosis is a disorder in which you inherit two genes from each parent. They have one normal gene and one bad gene that affects the glands in the body. It results in problems with the respiratory, gastrointestinal, and reproductive systems, but most importantly, the respiratory system, which helps you breathe. Cystic fibrosis causes the body to produce a thick, sticky mucus which blocks the lungs, pancreas, and the bile duct to the liver. This illness occurs from the child getting a bad gene from the parent. It can be diagnosed with a sweat test and is usually diagnosed by the age of 3. But for Hannah, it was a mild case and she wasn't diagnosed until after the age of 3.
The treatment focus for children with cystic fibrosis is being able to control infection and inflammation in the lungs and other parts of the body, like your bile duct or your pancreas. And it also focuses on reducing the mucus so that it's easier for the child to breathe. And if a child with cystic fibrosis does happen to get an infection, it can lead to hospitalization between weeks or months. It just depends on how bad it is. And Hannah will have to do airway clearance techniques 1 to 3 times a day. And before she does these, she has to take mucus thinning medicines and also medications to dilate the airways, which means these medicines will help open up her airways so that she can breathe better and get the mucus out since it'll be thinner. And then she can move into the airway clearance techniques. One of these is chest physiotherapy, which is when you cup your hand kind of like this and you clap on the chest or whatever area you're trying to loosen the mucus. And there's also an oscillating chest vest, which is a chest that you put on and it vibrates so that the mucus gets really loosened and Hannah can cough that up or get it out. And there are other expiratory techniques as well that Hannah might also want to do. Something that helps with cystic fibrosis is a lot of exercise and plenty of fluids. She needs to maintain a well-balanced, high-calorie, high-fat diet, and a lot of people with cystic fibrosis will also have to take pancreatic enzyme supplements because it affects the pancreas so much. And yeah.
So, as you see, Hannah has this disorder, but that doesn't mean that you guys can treat her in a different way. It is not contagious, so you guys will not be able to get this disease from her. So just make sure you treat her the same and are there for her if she needs it or somebody to talk to, because most people with cystic fibrosis usually only live up to 37 and a half years. So be there for her when she needs you.
And just remember that she's a normal kid and she's the same person that she was before she was diagnosed with this, and she's just like all of you guys.
So now we're going to do some activities to help you get a little more knowledge on what exactly cystic fibrosis is.